Once again, from the studios of UNO Television on the campus of the University of Nebraska at Omaha, consider this, a program of issues and information behind today's news.
When I first started getting sick, I was a third grade teacher, and I had to stop working. I was in excruciating pain. I couldn't hold down food. I couldn't breathe. I was in the hospital for Christmas, New Year's. I was always sick, and no one could tell me what was wrong with me.
Dale Johnson suffers from a long list of ailments, everything from congestive heart failure to type 2 diabetes. In 2012, she was hospitalized 5 times and went to the ER 12 times.
And she is just one of an estimated 90 million Americans. So now what? Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, chronic illnesses. Joining us to talk more about it are Dr. Renesa Anthony, a physician and assistant professor at UNMC's College of Public Health. She's also at the Charles Drew Health Center. And Dr. Julie Masters, chair of the Department of Gerontology, right here at UNO. Ladies, thank you so much for being here and welcome to the program.
Thank you, Kathy.
Dr. Anthony, we're going to start with you. How do you define chronic illness?
Great question. I'm going to start with how do we define illnesses, period. And there are 2 categories. There are acute illnesses and there are chronic illnesses. So I'd like to start with acute if you don't mind. So acute illnesses are those that come and they go. You unfortunately get pneumonia, you come in, we treat you, you're sick at that time, it goes away. You get something like the flu, it's flu season. I hope people are getting those flu shots. You get the flu, it's self-limiting, your body can take care of it. Sometimes there are medications we can give to help you, but it goes away. A chronic illness is something that you get, and unfortunately we can manage it, we can treat it, but for the most part it does not go away. So once you're diagnosed with diabetes, and not pre-diabetes, but once you have that diagnosis of diabetes, which means that there's a lab that we can draw, we see actual numbers that say this person has diabetes, most likely they're going to require some medications. You're going to have that for the rest of your life. And that's a chronic illness, a chronic disease. The difference is you can have a chronic disease, you can be well managed and live a quality life, or you can have a chronic disease and be poorly managed, and that's when we see some of the devastating things that can happen.
All right, so there are lots of illnesses that are labeled chronic. Help us out maybe with some of the most common and maybe some of those that we don't really know as much about.
Yeah, so I think the most common are really important because many people have them, and as we age, the risk factors get higher. So number 1 would be heart disease. We see heart disease with people who have high blood pressure. So high blood pressure, we call in medicine hypertension. That's a chronic disease. Diabetes is a very common one. Fortunately, we have some great treatments and management for diabetes, hypertension. Another would be high cholesterol. So that lipid profile and that cholesterol panel is really important. Things that you wouldn't think about these days that have become chronic would be something like HIV. And that, for instance, is an infectious disease, which is the category it fits in. 20 years ago was a death sentence. And now it's become more of a chronic illness because we have medications, we can treat it in a very different way, but it's still chronic because once you get it, you're going to have it for the rest of your life.
Interesting. Now, what are some others? Because as I was going through things, I thought, oh, I didn't realize that that was labeled or thought of as chronic. So maybe what are some of those that, other than HIV, that we don't think of as being chronic illnesses?
Maybe you can help me. What are some things that you saw that was
dementia?
Surprise?
Was one. That's another one that once you're diagnosed with that, obviously that is something that progresses, right? So I just think it's one of those things that we don't really stop to think of, and I loved your definition at the beginning, or at least you telling us about the differences between the 2 illnesses, because it really gets us on the right path here in terms of the way we're thinking as this program moves forward, right?
Yes.
Yeah.
So dementia is one that Absolutely as a chronic disease, and I'm glad that you shared that with me because I would naturally think about it as a chronic disease, although it is. And again, anything that fits into that category of once we diagnose you with it, you'll probably have it for the rest of your life, fits in that chronic disease category. So you would probably have a little bit more to add because I don't take care of that population, so it wouldn't be my natural first thought, but I think that you have something that you could add to this.
Well, I think in addition to dementia, and I'm glad you said it that way because it is something that is of a long-lasting nature, we also think about things such as arthritis. Arthritis that would be something like osteoarthritis that is of a long-lasting nature. I would add to that other conditions that might also play into that. So lung issues, breathing issues, chronic obstructive, the name itself, chronic obstructive pulmonary disease, would suggest that it's of a long-lasting nature and it's not something that's going to go away.
So when we think about these types of things, at least I guess I would assume maybe that folks would think, I don't want that, so I'm going to avert that. I'm going to change my lifestyle or I'm going to change my diet. And we're finding that's not really the case. If you could give us some 4 examples, Dr. Anthony, in terms of what happens to people if they don't heed, right, the warning signs. Talk to us a little bit about maybe some statistics, some facts, that path that we would tend to go down then.
Absolutely. So we know from research now that 20% of chronic illnesses and health outcomes can be attributed to genetics, unless you're talking about something like sickle cell or thalassemia, which is genetically inherited. And the rest is really attributed to our personal choices, our personal lifestyles. When we think about lifestyle, things like smoking, huge risk factor. When people ask me if I was never to see a doctor again, is there one thing that I could do that would increase my life quality and also increase my lifespan? And I would say, if you smoke, stop smoking. There are a lot of resources that we have now to really help with smoking and tobacco cessation. And the other would be, if you have never smoked, then don't start smoking. So we know that smoking is a huge risk factor. We know that diet and exercise is a huge risk factor, but it's not really the exercise per se. Exercise can help with when we're talking about high cholesterol, for instance. We know that there are things that happen in the liver where you can change those good, that HDL cholesterol that you want to be high and the LDL cholesterol that you want to be low. We've shown that by exercising, you can actually alter those numbers in the cholesterol panel. Other things that we know with diet, and that's really hard for people. It's not easy to tell folks over a lifetime, now you have to change what you eat. What we try to do now is something that's incremental, so making incremental changes to your diet and your lifestyle, because everyone has their challenges, and when you're overweight, expecting someone to lose 50 pounds, 60 pounds, 70 pounds, it took them quite some time to put that weight on. So what we try to do is we say, if we can start with a 10% reduction in your weight and give people feasible ways to do that. So why don't we incorporate a little bit more greens in your diet? Why don't we do something more with salad and live foods than maybe some of the more processed things that you've been eating? And why is that important? We know that obesity is a huge risk factor for hypertension, diabetes, cardiac disease, cancer. And so there are ways that we can prevent those things. And so we like to, in public health per se, is to prevent disease and to promote health. And that, what do they say, an ounce of prevention is worth a pound of cure. And so from a diet, lifestyle, exercise perspective, there are things that we can do every day, but it's not so easy for people. One of the reasons we see that it's not so easy is when you talk to the average person. You and I do this for our professions. I see patients every day. You have a show that's really focused, sometimes like today it's really focused on health. But people are living their everyday lives, and if they were to prioritize 1, 2, 3, we'd be lucky if health actually shows up on that agenda. And most of these things that we're talking about, the most common chronic diseases, diabetes, hypertension, cardiac disease, very rarely do you see them early in age. And so early on, when you're eating that Taco Bell and you're saying, I'm gonna watch Teen Mom instead of go run, then you don't see the sequela right away. It takes years and sometimes decades. And then you find people who are diagnosed with these chronic diseases. And I've actually seen, and research will show right away when people first get these diagnoses, they're very proactive. They do want to change their behaviors. They do want to be compliant with the medications. But when you've been practicing something over decades, it's really hard without assistance, without the support of a physician or the support of family or friends to make those radical changes. But the good part is there are people who do it, and they do it very well.
Yeah, and I think you bring up such a great point in terms of perspective. I tell people often, I'm so privileged to work with older adults for so many reasons, but one is to, you know, I am younger and I am seeing what can happen, right, if we don't take the path that maybe would have led us, right, to a better quality of life. And Dr. Masters, I know you in the classroom, you're working with generally younger folks, but you're working on behalf of the older adults. So from your perspective, hearing Dr. Anthony, what do you have to add to that?
Well, I think it's interesting that one of the challenges that we face in trying to communicate the drawback of chronic disease or of poor health behavior is that there is something that we can do about it. And if we would only think about aging as something that is a lifelong process, instead of waiting until we're 65 or 70 to think, oh, I better do something about my cholesterol or about my hypertension, if we could get people to think about it at a younger age, and we try to do that in our classes. For instance, a good example of a chronic disease is osteoporosis. But we know that in order to build your bone bank, that's something that happens when you're in your adolescent or teen years and early 20s. By the time you're 65, and if it's all right to say, the horse is already out of the barn by then, and while there are medications that we can take that can reduce the impact of osteoporosis and the brittleness of the bone, why not think about it earlier on in life so that we don't have to think about medication, but rather we've already built up ourselves to the best ability so that we can fight off disease.
Yeah, and if we don't think about it in those terms, some people are very financially minded, right? It's dollars and cents. They want to know what this is costing that way. We do have a graphic that we want to put up for our viewers that really outlines what not doing something about this at some point is costing us as a country. So, Dr. Anthony, if you would walk us through that graphic.
We know that the #1 cause of death in the United States is attributed to heart disease. And so when we look at heart disease and stroke, it costs us about $432 billion a year. Diabetes, about $174 billion per year. Lung disease, which fits into what you were talking about, the chronic obstructive pulmonary diseases, about $154 billion per year. And then Alzheimer's, which has really gotten a lot of attention in the past decade, about $148 billion a year. Well, to the average person reading those numbers, what do those numbers mean? How are these numbers calculated? And I like people to think about those numbers as lives and quality of life, and whether what you're doing now and what you can do to improve your quality of life long term, it's worth every single dime. But how they calculate these numbers has to do with when we look at what's called premature death, how many people die before a particular age that you would expect them to die at statistically. We look at the dollars lost in productivity. So a person who has diabetes or a person who has a chronic illness that requires doctor's visits, that means they're not at work as often as they would be. They have to take more time off. They may have, when people have diabetes and it's poorly managed, unfortunately that can lead to things like blindness, amputations, osteoporosis that you were talking about, which is a great, and I love women's health, so that's a great example. It impacts your quality of life, so the numbers matter. But if you're a woman and you didn't do the calcium replacement, you didn't have enough calcium in your diet, you weren't doing the weight-bearing exercises, and now you're in your early 50s, 60s, and you're dealing with osteopenia or osteoporosis, it can really impact your quality of life. You've worked so long, you're looking forward to retirement, you're not going to be able to go on that trip because now you have brittle bones. There are different things that you may be dealing with that had just a little bit of prevention could have completely changed your quality of life long term.
So she's really talking about human costs, right? And we do have a
Absolutely.
graphic we want to put up for our visual learners just to kind of outline what some of the more common might be. And then I'll certainly invite the two of you to add from your own experiences. So we'll put that up. And Dr. Masters, if you could walk us through those.
You know, I think it's interesting when you talked about as far as lives and we think about premature death. Right now, 7 out of 10, every 10 deaths in the United States can be attributed to some form of chronic disease. The leading causes of death in the United States include diabetes, cancer, heart disease, as they relate to the disability itself. Although when you look at actual death data, heart disease, cancer, chronic obstructive pulmonary disease, and stroke would be in those top leading causes. I think the other thing that's important, and when we think about the cost of chronic disease, what we're really talking about is, you know, in terms of lost days at work, but we're also talking about functional health and a person's ability to maintain their own independence in their home. And so when we think about functional health, we also have to think about who's providing that support. So when we talk about cost, someone else that's part of that equation is the caregiver. And whoever that family member might be, or it might be close friends, distant relatives, that have to provide that support. And so that only adds to the expense that you're talking about as part of this show.
Mm-hmm.
And also, what does it cost the insurance companies? We know that majority of the healthcare dollars that are being spent on the sickest people.
Mm-hmm.
And that
right.
we've been able to show that by focusing on prevention and through health promotion, that we could really save a lot of healthcare dollars in the United States. Is this something?
Well, and I think Dr. Anthony, what you're talking about is so spot on, particularly when you think about insurance companies and the idea of rising healthcare costs. And with those healthcare costs, then we start looking at a decrease in quality care, as well as fewer options that might be available for someone. And then the other thing, and I think folks are seeing this more, is the out-of-pocket expenses that are associated with chronic disease. Things that they may not have anticipated, again, not realizing that as they age, chronic disease might be an issue. And I think that the other thing, we've done a good job with quantity of life. You know, right now, life expectancy, CDC has just reported that average life expectancy has increased to 78.9 years overall. Different groups are going to have different life expectancies. But while we've increased quantity of life, and you touched on this, it's that idea of quality of life. And the idea of being able to live a life that's primarily disease-free. If I could for just a second, there's something that Fries and Crapo talk about in their book Vitality and Aging, and this idea of compression of morbidity, morbidity being disease. And the compression of morbidity is we want to push off disease and disability for as long as possible so that the length of time between the onset of disease and death is shortened. So instead of living with something, and the examples you provided were spot on, so instead of living with heart disease or hypertension or cancers or other things for 20 years or 30 years, how about only for maybe 5 years or even less than that?
Yeah, it's really hard to get your arms around this whole notion of, you know, what we plan for the least before 65, or that fixed income marker, right, is the thing that costs us the most after that. And to both of your ladies' points, you get to a place and somebody tells you you have this now, or this is progressing, and it's only going to get more costly, not only financially, but from a quality of life standpoint. So I guess let's talk now in terms of solutions, but I think what I want to do prior to that is really look more at this humanistic side. There are people out there with chronic illnesses. They have them now, and they're living with them. Dr. Masters, what is the most important thing for us to remember when we come across these people who are dealing with this to the best of their ability?
You know, I think, and we tend to think about aging as a disease, and we think about older folks as being one large example of a multitude of diseases, and to realize that while someone might have a chronic disease, they are still an individual. And each individual is going to approach that disease differently. What the literature tells us is when you ask an older person, how would you rate your health? Most say that their health is pretty good, even though they might have multiple chronic conditions. They'll say their health is pretty good. And so what we have to look at is, in terms of their functional health, what can they do in terms of their independence? What can they do to maintain their independence? And what can we do in looking at supplemental resources? And when I say resources, I'm talking about services, support in the home that can help them maintain their independence.
Okay, very good. And Dr. Anthony, I'm sure you have lots and lots of stories that you could share in terms of success stories for people, right? Maybe folks who were diagnosed and things didn't look so good for a little while there, and because they did some of the things that we're talking about during this program, they really did turn their lives around, and they really did have that quality of life that Dr. Masters spoke of. And I think sometimes just the use of examples is a good teaching tool. Is there anything coming to mind for you, that face that you're seeing, where that could be kind of inspirational for folks and give them the little push that they need, right, to try to avert this stuff?
Sure. I do want to comment on something that you said when we were talking about, I love that whole quantity of life versus quality of life. And a lot of the work that we're doing at the Center for Reducing Health Disparities at UNMC is really looking at that, because unfortunately, during a time where I was delivering babies, so I was at the beginning of people's lives, unfortunately, based on that baby's gender, that baby's race, and now if we have zip code information, we can be pretty spot on how long we can expect that child to live. And that's kind of unfortunate in the United States, that based on your race, based on your age, et cetera, and your gender, we can make that prediction. And you might be asking, because I can see from your look, like, why would that be?
Interesting.
And we've learned that there are things called the social determinants of health. There are social things in our environments that determine our health outcomes. So as easy as it is for us to talk about diet and exercise, the reality is that there are certain people who live in environments where getting up in the morning and running may not be something that's feasible. That where they live, it's more unsafe outside than it is inside. The idea of saying get a gym membership so you can work out and a personal trainer, well, the cost of that is too large for that person to really identify with that. So what I was able to see is that the things that are most successful with individual patients is when you tailor and you customize a plan. And when you talk to that patient, not just about what we see on paper, what the numbers are, but really tell me about your life outside of when you're here. Tell me about where you live. Tell me what's reasonable. Again, I'm not expecting you to lose 50 pounds. We've got 50 pounds that we need to lose, but we're not going to lose them overnight. So why don't we start with about 10%? And partnering between that healthcare professional and the patient and identifying what's realistic. Because I found that patients, when you come in with that white coat and you're the doctor and you're saying, hey, this is what's going on, this is what you need to do, I found that it's not as easy for someone to ask you those questions or actually push back. And so now I think in medicine, or where I've seen it be as successful as possible, is when there's a partnership. It's I make suggestions, you tell me what's reasonable, what can you do, what can't you do, but really having that support. These types of things cannot be done alone. There may be some, outliers where people have been able to do it alone, but the largest success stories are when there's a team working with you, there's support, and whether that's your community or your family or your healthcare professional, that's where we have seen some changes, whether it was weight loss or managing, say, your hemoglobin A1C for diabetes, but get to know that person and what's going to work for them. And then figuring out what can possibly be an incentive, reward and celebrate even those tiny, tiny steps that people are making.
Well, and I love this because you're talking about the here and now, right, and that partnership, and Dr. Masters can tell us in just the minutes that we have remaining this whole concept about introducing yourself to your future self. So we get to know ourselves today, and we're working in partnership with Dr. Anthony, but we're also looking down the road in terms of where we want to be 10, 20, 30 years from now.
For the first time in history, we can pretty much guarantee that you're going to live to be an older person. Now, older might be 65, it might be 75, 85, 95, but we can guarantee that. So it's that question of, what do you want to be like when you're that older person? Do you want to have multiple chronic conditions, or do you want to be in pretty good health and be able to take care of yourself and stay in your home? So you can make a difference. You can make a difference even if you are in your 50s and 60s, working with your healthcare partner. And I think, Dr. Anthony, when I listen to you and I think, gosh, you're the kind of doctor we all want in our lives, because you're the one who's saying, this is really a partnership. And I think if people are going to be serious about their own aging experience, they need to have a partner they can trust, who's going to make the journey with them and say, I'm not going to abandon you. I'm going to figure out what's going to meet your needs based on your story, so you can live your best possible future self.
Fantastic. Finally, I want to ask, in just the couple minutes we have remaining, initiatives. What can we expect to see down the road that might help us in terms of costs and so forth when it comes to chronic illnesses?
Well, in Nebraska, I know people have very conflicted feelings about that Affordable Care Act, or Obamacare, whatever you call it. And I'll say it's not perfect, but it is a step in the right direction. For the very first time, when it comes to healthcare, we're truly looking at health and caring from a healthy perspective. Our system has focused on a sick care system from an everyday person perspective. When they think of doctor or hospital, it's connected to, I go to this person when I'm sick. I go to them when something's wrong. And for the first time in the 21st century, we're really starting to focus on, how can we promote health? How can we really focus on prevention? And healthcare providers are being educated, and I think we see now, like, taking care of those who are sick. What can we do? That's important, because there are people who do have chronic illnesses, but what can we really do to start what you're saying? How can I prevent that person from being diagnosed at 40, 45 with hypertension to maybe that diagnosis comes at 65? And so there's a lot of work going into that, and I think that there's a shift in the paradigm as to how we're thinking about healthcare providers and making sure that we're promoting health and trying to prevent disease and not just treating and managing disease.
Thank you very much. If folks want more, we're going to put up a graphic. They can go to a website, right? And they can even contact you, I suppose, Dr. Anthony, correct? UNMC.edu/public health. Phone number 402-559-4960. Dr. Anthony, Dr. Masters, thank you very much for being here to share your time and expertise. We appreciate it very much.
Thank you. It was a great gift. Thank you.
Awesome. And thank you all for watching. We'll see you next week.
Consider This is an issues and information program produced by UNO Television. More information can be found at unotv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours, or email us at considerthis@tvmail.unomaha.edu.